Hi, this is Dr. Terry McCatton of West County Plastic Surgeons of Washington University, and today I'm going to be talking a little bit about the different types of breast implants. So very often when we're talking with our patients about either breast implants for breast reconstruction or breast implants for cosmetic surgery, we're getting into conversations about what the different options are for the different types of breast implants. So essentially, these are the things that we're talking about. So one is going to be the fill of the breast implant, whether that's silicone fill or saline fill. Two is going to be the surface characteristics of the implant, whether that be a smooth surface or rarely a textured surface. Three is going to be essentially the firmness of the breast implant, and that has a lot to do with how filled the breast implant is, or the firmness of the fill if it's a gel or silicone filled device. And then finally is going to be discussion about the size of the implant and essentially the proportions of that. So is it a wider implant versus less projection, perhaps a narrower implant with more projection? So starting at the beginning, silicone versus saline. So essentially, silicone implants are filled with gel, silicone gel. They tend to feel, in many cases, a little bit more natural, whereas saline implants, particularly if there's not a lot of soft tissue in front of them, may feel a little bit less natural, perhaps a little bit more of a sort of a saline bag type of feel. The other thing, though, is that silicone implants and saline implants can both eventually leak. And silicone implants, when they leak, can be very subtle, and the plastic surgeon and the patient may not actually be able to tell that there's a leak. So to try and eliminate that potential issue, patients are recommended to have imaging of their breast implants sequentially down the road. Currently, the Food and Drug Administration recommends that patients get imaging of silicone breast implants usually around 6 years after placement, and then every couple years after that. In our practice, we typically start with an ultrasound, and if that is inconclusive, then we will order an MRI exam. The silicone implants and saline implants tend to last about the same amount of time. The rates of scar formation or painful scar formation around the breast implants, known as capsular contracture, have similar rates between silicone and saline implants. The second thing that comes up is the surface characteristics. So those are either smooth surface implants or textured surface implants. For many years, plastic surgeons were using textured surface implants to either try to reduce the risk of something called capsular contracture, which is thicker scar formation around breast implants, but also to help to stabilize the position of an implant so it didn't move up or down, side to side, or rotate. Essentially, the texturing almost functioning like Velcro to keep the device in place, and that was particularly important when shaped or teardrop shaped breast implants were being used. Unfortunately, textured breast implants do have a real, very low risk of forming a rare type of lymphoma called breast implant associated anaplastic large cell lymphoma. The risk of this is extremely low. However, it is a real entity, so it can exist. And so a couple years ago, some of the most common textured breast implants were actually fully pulled off the market, so they were not being placed anymore. And certainly in our practice, we are not using textured breast implants at all, even the ones that remain available. And so we're essentially just using smooth surfaced implants. What that means is that we're essentially using just round implants at this point, because the textured devices are the only ones that have shaped options. Then the third thing that can come up is the firmness of the breast implant. A firmer breast implant can be achieved with either filling it up more with salt water or silicone gel, or the density or the firmness of the silicone gel. Devices that tend to be a little bit more underfilled or have a softer gel do tend to have more ripples. Devices that tend to be a bit more overfilled and firmer do tend to have fewer ripples. And so that can become a little bit of a personal decision as to whether somebody's preference would be to have a softer breast, but potentially accept some more noticeable ripples, or vice versa, that having any ripples is more of an issue and that they would prefer a firmer breast. And then finally, the other issue, of course, is the dimensions of the breast implant. So its size, its width, and its projection. So for example, here I have 2 breast implants, and these are a higher projecting and a lower projecting one. They're both 330 cc, so they're the same volume. But you can see that this one, its a footprint is shorter than this one. So how can they both be 330 cc's? Well, the answer is the amount of projection. So the device in this hand here projects more than this flatter device here. So to get to 330 cc's, you can have a device with a narrower footprint but more projection versus a device with a wider footprint but less projection. And again, there may be various reasons why patients and their surgeons will pick one device versus another. But this is a little primer on breast implants and the types of things to consider. So again, the silicone versus saline fill, the type of surface, how firm it is, and then finally the dimensions of it, its size, its width, and its projection. I hope that was helpful for you. Have a great day, and of course, if you have any questions about breast reconstruction or cosmetic surgery with breast implants, please consider West County Plastic Surgeons of Washington University in St. Louis, Missouri. Thank you.